Welcome, everyone. Thank you so much for joining us this evening and making time in your busy schedules to really find community with us and share some time. My name is Semra Aytur, and I'm an epidemiologist and an associate professor in the
Sorry, Semra, I think you got muted there.
Okay, I'll just repeat real quick. It's really just my quick bio. I'm Semra, and I'm an epidemiologist and an associate professor in the Department of Health Management and Policy at the University of New Hampshire. I teach in the Master of Public Health program at the University of New Hampshire, as well as in the Sustainability Dual Major. So welcome all students. So glad if you could join us. And I also co-chair the Climate Justice Working Group for New Hampshire healthcare workers for climate action, which if you found this space, you are now here. Welcome. And I am just thrilled to be joined by our speaker today, Dr. Gaurab Basu, who will be speaking to us about climate change, structural racism, and organizing for change. So we are just delighted to have Dr. Basu join us. I know that I have been waiting for his talk for at least 2 or 3 months, and I've told all my students about it. So I am just so happy that the time is now. And just to introduce Dr. Basu, he wears many hats. In addition to being a practicing physician, he is the co-director for the Center for Health Equity, Education, and Advocacy, or CHEA, love that name, at Cambridge Health Alliance. He is also a Health Equity Fellow at the Center for Climate Health and the Global Environment. He's the faculty affiliate at FXB Center for Health and Human Rights at the Harvard T.H. Chan School of Public Health. And he's an instructor at Harvard Medical School. I've probably missed a couple of things because he wears so many hats and balances them incredibly gracefully. So with that, I would like to turn it over to Dr. Basu. I know he has an incredible presentation for us tonight. So Gaurab, over to you.
Thanks so much, Semra. And it's a pleasure to have all of you here. I'm humbled that you're interested in spending the evening discussing some of this material together. So thanks for joining. And it's wonderful to be a part of this webinar, and also just a real congratulations to the New Hampshire group, who's been doing so much great work to get off the ground and have been following along and seeing the ways you've been engaging students, health professionals, policymakers. It's really kind of how this stuff comes alive. And I'm sure that you all have your challenges in New Hampshire, as we do here in Massachusetts, but I really do believe in this work of collective action and declaring climate change as a way of us better caring for one another and in our future. So I am going to put my slides up here. And what my goal is to in about 40 minutes, let's say, go through some material and then try to save some time. So if you're interested, would welcome you just to introduce yourself in the chat and just say your name and what brings you to this work, or what you do, or some way of kind of identifying where you're coming from, and then we'll get an opportunity to kind of chat, hopefully, and have some discussion. So I'm really kind of trying to facilitate a conversation here more than anything. Okay, so bear with me. I've been having a finicky. I'm gonna apologize if my slides are a little sticky. I've noticed that's happened in the last few days. Okay, whenever I start talking, I begin with this point that climate change is an emotional issue, and as a doctor in public health, I really do try to articulate the public health data and explain the research and describe the connections between climate and health. But I actually think it's important to start at a place about just acknowledging the emotions that climate change elicits. So maybe another request will be, and maybe Semra, if you could help me, because I can't quite see the chat, if you could list one emotion that comes to mind when you hear the word climate change. What is that one emotion? Semra, if you could just read a few of them.
I was going to give people just one more breath here And I'm going to start reading them in order: terror, fear, stress, anxiety, excited to be here and learn more, but also fear simultaneously, urgency, fear, grief, dread,
Great.
desolation,
You
stress,
know,
hope.
I felt all of those. Thank you, Semra, for that. You know, I think it's important just to say the words, to get it out there, because I think actually, you know, for so long I was frustrated that why don't more people care about climate change? Why aren't they kind of putting at the forefront of how they, you know, orient to their days and what they're working on and all that? And I've really come to the place where I really believe that most people are just so overwhelmed and scared about it that it's like the buzz in the back of our head, and that we kind of keep pushing it back because it just feels so overwhelming. So I'll tell you, you know, I was not, I did not see climate change the way I should have, I think, until 2018. So my background's in global health and human rights work, you know, I was working on things abroad and women and children's health issues, but really had my awakening during the IPCC report in 2018. And it really helped me just see how that climate change was a threat to everything I cared about as a physician and the issues I cared about. And also as a parent. My wife was pregnant at the time. We had a 2-year-old child at the time. They're 5 and almost 3 now. And so I certainly come into this conversation, as many people do, caring about future generations and the children who will inherit this planet. And so I have gotten to the place, and this is, I don't feel like, who am I at all to say what anyone should feel, because I feel all the things that everyone has described here. I've come to a place where I'm able to hold all of those emotions that you described, and also hold some courage and hold some optimism and determination alongside of that. And I do think for us to move forward and to boldly reimagine the world that we want together, we are going to need action, and we are going to need people to step forward and put a positive vision of what kind of world we want to create, and that having some hope and some determination is really critical for us to bring it to the forefront of our action and our consciousness. And I hope that, you know, this could be a part of that. And of course, you have all these great organizations and all the great work you all are doing already that provide you community and support and all that work. All right, so 9 ways that climate, and Semra, I'm sorry, my internet was breaking up a little bit. I cut you off for a second, so I apologize.
No, you're good. You're good.
So 9 ways that climate change and fossil fuels impact health equity. So this is the way I think about it. Natural disasters / extreme weather, food insecurity, water scarcity, infectious diseases, heat-related diseases, air pollution, mental health, forced migration, political conflict. So these are the ways in which I see the direct connection between climate change. Heat-related illnesses, air pollution, you can basically go through every organ system in the body. You could break this down in a different way of how does it impact the heart, how does it impact the kidneys, how does it impact the brain. There's many different ways that you could organize the impacts of climate change on health, but this is the framework that I kind of think about as the direct kind of vectors onto human health. And I want to make a point here that, you know, I'm doing it today, and I'm kind of catching myself and calling myself out here, that, you know, we talk about climate change a lot, and that has an important kind of political context now, and I think it's okay to use that term. But planetary health is something more than that, and I think we really do need to be anchored in an understanding of that. So planetary health is not only climate change, which is greenhouse gas emissions causing heat trapping phenomenon, so that our atmosphere is warming, but also issues of biodiversity and ecological stability, issues of deforestation, of air pollution is a separate issue than greenhouse gas emissions, about how we're encroaching into habitats and destroying them, and how we are using land and water, and our relationship to agriculture and wildlife. And of course, that's at the top of my mind as a doctor. I've been pulled into the COVID team numerous times during, you know, each surge in the last 2 years. And COVID being a zoonotic disease starting in animals, it's critical that we write our relationship with nature, and really be thinking about how the stability and health of our ecology is critical to the health of humans. So I'm going to tell you about a patient of mine to get us started here. So this is my hospital. I work at Cambridge Health Alliance. And so there was a 30-year-old male. He had asthma, moved to the United States about 5 years prior to this emergency room visit from Central America. He hadn't established care in the United States. He wasn't my patient in primary care yet. Back home, he was a farmer in Central America and the parent of a young child. His wife was saying, "Hey, you've been having these upper respiratory symptoms for some time. Why don't you go in and get checked out?" So he wasn't immediately, but then started having some shortness of breath, or orthopnea, which is feeling short of breath when you're lying down, having headaches and fatigue, and it was getting worse. And so he went in, and tragically for the health professionals in the crowd here, they'll know that these basic labs had a stunning diagnosis, and that he was in acute on chronic kidney disease. His kidneys had failed. His electrolytes were disrupted, so that he had to emergently go into the hospital and get onto dialysis. So at 30 years old, he had thought he was in a normal state of health, had no reason to think that he was ill in any way, and had a dramatic and devastating diagnosis that his kidneys no longer worked, and that he would need dialysis for the rest of his life if he didn't get a transplant. And absolutely, of course, upended his life. All right, I'm not going to do my mouse. I think if I just use my arrows, it'll work. So after a really extensive evaluation, a very comprehensive evaluation, he didn't have a history of diabetes and blood pressure, other kind of genetic issues that could have caused such a kind of dramatic and unique renal diagnosis were ruled out. He was found to have something we call CKDU. There's many different terms. CKDU is chronic kidney disease of unknown origin, which isn't the best name. Heat-triggered renal disease. This is a perspective piece from New England Journal. I like that term the best, probably. It's also been called Mesoamerican nephropathy. And so basically what we understand of this phenomenon, while there's a lot that still needs to be figured out, and some of the mechanisms are still being researched right now, it's an under-researched area with no surprise with the equity implications here, was that my read of the literature makes me confident enough to tell you today that I feel convinced that his work in the farms back home in Central America exposed him to extreme heat day in and day out for decades, right? He was a farmer back there for about 12 years out in the heat. And that extreme heat day in and day out, without him even understanding, was dehydrating him so much that the blood perfusion to his kidneys were decreasing, and his kidney was just getting dinged up every day, little injury by little injury, because the blood flow wasn't getting there enough because of the dehydration phenomenon. We call it a pre-renal event. And that was happening over time, slowly but steadily, so that suddenly the kidneys just failed. And that's how it works often. And he came to the hospital, hadn't been with a doctor, didn't get these basic labs. There was really no reason for him at his age to do that. And was found to have his kidneys not working. This is the way that we think about the ways in which our organs and our health, our physiology, our anatomy is interacting with our climate. And of course, I think about climate change and farmers a lot when I think about this nexus of climate change, structural racism, health equity, because these folks are out in the farmlands providing food and nourishment for their communities, doing the hard work and labor out in the sun, providing the basics of human health, and in fact are putting themselves at risk because of the increasing risks of extreme heat in this new era of climate change. And it made me start thinking, this was part of that time when I was in the midst of my awakening, started thinking about all the people I should be thinking about. Whether or not you take care of individuals who were farmers back in Central America, I started thinking about my folks who are working in factories here, who are construction workers out in the summer heat. And was I really thinking about all the ways in which heat was a risk to their health? This is a little diagram from Union of Concerned Scientists here, showing that heat is a threat to everything I care about as a primary care doctor. It increases strokes, it increases heart attacks, it increases respiratory diseases, in cases like my patient, kidney disease. There'll be a few other pieces that we talk about here, but heat is a major threat to human health. And again, I think something that we don't talk enough about is mental health as well here, with increased hospitalizations for psychiatric disease on very hot days. I know you all are in New Hampshire and not getting it as much as states, on the southern area here, but you all, I'm sure, have had exposure to heat on days in which we don't do well on days that are really hot. and it impacts the ways in which the burden in which whether we want to go outside or not, and some people don't have a choice of whether they have this chronic exposure. So as I dug in more and more, I was trying to understand really, what is the threat to my patients here, and really appreciated that Middlesex County, which is the county that I work in, had warmed 70% more than the rest of the United States. And the Northeast is the hottest quadrant of the United States. It is warmed fastest, I should say, than any other quadrant of the United States. We're not exactly sure why there is. There's some hypotheses that a jet stream in the Atlantic called the AMOC, because the Arctic is warming, the poles are warming the fastest, the streams from cold to hot are changing, and those kind of jet streams in the oceans are changing the weather events here. And so we're still trying to understand, what this means for us into the future, but it is important for us to say that the Northeast is warming at an alarming rate. All right, and everything I've talked about so far, we can see through a lens of equity and of racial justice how this is disproportionately impacting communities of color and poor communities. And so this was a piece that came out a couple of years ago, and I want to make sure everyone's familiar with the term of heat islands, which means that this piece was written about Chelsea, Massachusetts, which is a community just about 15 miles away from where I live in Cambridge, is 80% Latino community. I take care of a lot of patients who are from Chelsea. And Chelsea is a red-lined community. I know many of you know what red-line communities mean, but from 1934, during New Deal, these policies were started during New Deal policies that were enacted in 1934, existed until the Fair Housing Act of 1968. So for 34 years, on the federal books was explicitly racist language. It's hard to read when you read it, saying, incentivizing, encouraging banks and mortgage companies not to invest in redlined communities. Words like infiltration of people of, immigrants, people of color, do not invest in these communities. And it's important for us to connect the dots of 34 years of that kind of policy, pulling out actively the resources and investments into these communities, and connecting that to what it looks like here. And this picture gives you a little example. So what's happening here? You won't see very much green space. There's a couple trees here. I've been to Chelsea a few times. You go there, there's barely any trees. It's an industrial space. It's where all the fossil fuel stuff is loaded up. So Chelsea air quality is past the EPA limits of what is appropriate for appropriate air quality. It's a polluted area in its air. You go to the Chelsea Creek right by the right near this photo here. That water is polluted because the fossil fuel infrastructure was built there. During snowstorms, like we all had recently, all the snow mount or the salt mounds to take care of the roads are all loaded up in Chelsea, so that the big trucks go there, load it up, and go around Massachusetts, at least eastern Massachusetts, and salt the roads. Now that's going to increase all of the vehicular emissions in this community. This community is right by the Tobin Bridge, a major freeway, and so that increases all of the emissions there. And it's important for us to connect the dots of how these things manifest. It didn't just happen out of nowhere. It was purposely done through policy, and we're going to get to why I think we need to really reckon with some of this and ask ourselves some hard questions. And so we're in the midst of a great reckoning, a very painful time. All of us, in one way or another, are trying to navigate these extraordinary times. People generations from now will look back at 2020, 21, 22, wonder what we were thinking and how we thought, what the answers to the things we were seeing. And clearly we're working our way through it, and we're working a lot of things out about the ways in which we reckon with these deep-rooted issues we have. So there's a photo here from California a few years ago, a major wildfire decimating a senior center with a COVID sign outside. We're trying to reckon with racial justice in the medical field. And so again, the emotions that you described, again, I feel too, feeling overwhelmed that these are deep rooted, these are systemic, they're just so widespread that how could we ever make progress with it? I've come to a place in believing that the critical thing that we have to do is do that deep rooted work. In climate change, we often operate on the dimension of urgency. And that's obviously real. There's a clock to this. We got work to do. We've got a long way to go. And going with urgency and ambition is in my wiring. But I think it's important for us to also operate in the dimension of depth and to make sure that we are doing the deep work to see the ways in which the converging crises of COVID, of climate, of racial justice, all really can be deduced from some root issues of how we've organized our society and how we want to relate to one another, how we make commitments to another, how our organizing principles of what kind of society we want to create. If we can get to that deep rooted place, which is hard, right, to have conversations and unpack all of that, we have the opportunity to unravel some of these vices all at once. And that's what gets me animated, determined to do that deep rooted work. And so I touched upon this, but there's that adage that every system is perfectly designed to get the results that it gets, whether it's Chelsea, Massachusetts, or communities in New Hampshire. Things don't just end up the way they end up just by accident. People make policies with purposeful intentionality of prioritizing some things and taking away from others. And that's where this definition of structural racism really comes to my mind. And so if you don't know Dr. Kamara Jones's work, please do read it. This Gardener's Tale is a great piece to read. She was a former president of APHA, a thought leader. You know, I think there's probably no one who's more respected than her in the field of racism in medicine right now. And she defines racism as a system of structuring opportunity and assigning value on the social interpretation of how one looks, such that it unfairly disadvantages some individuals and communities, it unfairly advantages other individuals and communities, and it saps the strength of the whole of society through the waste of human resources. And I would add ecological resources to that. And so when I hear this definition, I immediately think about climate change. It's immediately what I think about, that we have loaded up the fossil fuel stuff in some communities and we've protected others from it, that we've wanted some people to have, myself included, certain quality of life, certain lifestyles so we can live in a fossil fuel scaffolding. And it's okay as long as the negative implications are on certain communities only. We'll talk about this in a second, but I also want to amplify the global implications of that. There's always, of course, all these communities. You can break down Massachusetts, break down New Hampshire, but when we think about the United States, we think about the developed world, and how much of the emissions that Europe and the United States has disproportionately caused throughout history. Remember that CO2 stays in our atmosphere for hundreds of years. So what we've been doing for the last 120 years is what we're manifesting today. And you think about the global South and how a tiny piece of the footprint, the carbon footprint, is because of their emissions, and yet they're the ones most disproportionately impacted. That's absolutely wrong. That's unjust, that's undignified, that's unacceptable, and we shouldn't be able to look away from that fact. So here's a little bit more kind of concreteness to some of this. So Jeremy Hoffman's down in Virginia, and in 2019 had a major study that was featured in the New York Times with a lot of different maps, and he's really, a lot of attention has been brought to this study, as it should be. He studied 108 US communities, half of which, studying redline communities versus non-redline communities. So we talked about that in the context of Chelsea, and this study showed that Chelsea was not alone, that in fact, redline communities were 2.6 degrees Celsius hotter than non-redline communities. And I think most of you all know this, but 2.6 degrees Celsius is profound. It has major health implications, thinking back to that graph I showed of all the different organ systems that are impacted by severe heat. And so again, we've got to think about how those policies for 34 years has played out in a way in which extreme heat and chronic heat has disproportionate impact and exposure in today's societies. Another piece here is the transportation system. So we take a lot of pride, right? In the 1950s, we had the interstate highway bills and we created highways across the United States. But you look at places like Houston and Detroit and New Orleans, here in Roxbury in the Boston area, folks tried to put an overpass through predominantly community of color, and it was fought off, I think in the 70s. But these overpasses and these the vehicular emissions that are coming from the highway systems, again, the studies are showing that those are disproportionately impacting communities of color. So we put those highways somewhere. It wasn't just accidental. And we again, going to Dr. Jones's work, we advantaged some people and disadvantaged others. All right, here's another study, one of those ones that keep me up at night. I think some of you have seen this, but the association between air pollution and heat to premature birth, low birth weight, stillbirths in the United States. This is something that, again, is just the word undignified comes to mind, is in a way in which we need to articulate climate change as an issue of racial justice and health equity. The study doing a sub-analysis did show that Black parents were disproportionately impacted by these threatening exposures. Let me just say a quick word about air pollution. So a striking number is that in 2018, a recent study showed that almost 9 million people died from air pollution alone. And that's just a jarring number. 1 out of 5 premature deaths were due to air pollution. And an encouraging thing here is that while emission CO2 stays in the atmosphere hundreds of years, methane probably somewhere between 10 and 20 years, air pollution goes away right away, as of course we all saw during the COVID lockdowns and all that. And if we're able to get our hands around decreasing air pollution and the particulate matters that come out of burning fossil fuels, we are going to see health benefits right away. I just read an article saying Los Angeles already is starting to see a tiny improvement in air pollution related disease morbidity, because of the use of EVs in Los Angeles. And so this is just a striking number. I think we need to be talking about global warming and climate change, and separately be understanding, the issues of air pollution, its impacts, and its benefits of stopping the burning of fossil fuels. And this is just another study that while air pollution has improved in many ways over decades in many communities, that the equity issues, the disparity issues are actually increasing of who is exposed. And again, I made a point about the global health implications. Let me just re-emphasize that. This was a piece I wrote with Dr. Chaudhry, who founded the Child in Need Institute in West Bengal, which is where my family is from. I worked with them since I was a student in public health. These are rural villages that are along the coast of West Bengal. And in 2020, the same week that the Proceedings of National Academy of Sciences had a major study showing that super cyclones, Category 5 hurricanes were associated with climate change. Cyclone Amphan came through West Bengal and Bangladesh, decimating these communities. It's not just the impacts of these hurricanes, it's the fact that organizations like the Child in Need Institute have been working decades to provide nutritional supplements for children in these communities, get children to stay in school and say, hey, listen, your family is poor and they're operating small businesses out of their huts in these villages. And there's a pressure for you to not go to school and help out so your family can survive financially, but please stay in school. And when the economic devastation that happens from issues like these kind of cyclones, it wipes out decades of work. Dr. Chaudhry argues that 20 years they went backwards with Cyclone Amphan, not to mention Amphan was happening during a surge of COVID cases. And then a year later, Cyclone Yas comes through and hits Orissa right below West Bengal. And so you picture these children, these families getting wiped out by these events, having to rebuild and knowing that they're at the crosshairs of these extreme weather events is absolutely unacceptable. And of course, again, these communities did not create this crisis, we did. So this is that IPCC report, which I know many of you are familiar with. This was my eye-awakening moment Let me just make sure that we all know these numbers, that we've warmed. This was back in 2018. Now we think it's not 1 degree Celsius, but probably 1.2 degrees Celsius. We think that our warming will happen sometime. Now, increasingly, it seems like it'll happen in the 2030s, that will warm to 1.5 degrees Celsius. And to limit climate change to 1.5 degrees Celsius, the goal is to about half our emissions by 2030 and wipe out all anthropogenic, human-made greenhouse gas emissions by 2050. So again, let's say it this way. By 2050, we need to end the era of humans burning fossil fuels and causing greenhouse gas emissions. And in order to get there, we need to get halfway to decreasing our emissions. The UN says we need to decrease our emissions by 7.6% a year. So we have choices. You know, this is a very busy graph. I'm not going to go through everything. You don't need to, one lesson I've learned, you don't need to know all the climate atmospheric science to get your hands dirty and get into this work. But we are here, and there's different branches here of where we go, whether we mitigate to 1.5 or 2 or 2.5 or 3 or 4. And there's good news and bad news. We used to be really worried that we would be hitting 4 degrees Celsius, which truly would be an existential crisis. And now we are wondering if we're going to be somewhere, I think probably, somewhere between 2.5 and 3.5, which would completely change what the Earth looks like and would cause devastating harm. And it is also true that there's nothing stopping us actually from mitigating to 1.5, and that we have all we need to continue to pull this arc down. We'll talk more about that. This is a little bit of a busy graph, but let me just kind of walk through it here a little bit. This is, reasons to have hope. So on the top here, May 2021 update. Okay, so this is the climate action tracker. So look at the middle blue bar, the darker blue bar that says current policies. So it says, listen, in May 2021, current policies will get us to about 2.9 degrees Celsius of warming. That's what our current policies. Then go to the left there, the pledges and targets would get us to about 2.4. What that means is that, hey, countries have put certain policies in place, 2.9, but the pledges and the promises that they haven't necessarily put policies in place for could get us to 2.4. And then maybe in the best case scenarios, optimistic targets would be 2.0. Okay, does that make sense? That's a little bit, basically showing different scenarios with different actions. Then you go down here, November 2021. This was right after Glasgow, after the commitments made during Glasgow, which was a mixed bag, made some progress, but a lot of missed opportunities. So this is a little easier to read. Policies in action. What are in place, laws, the policies in place globally? 2.7, okay? Some progress from 2.9. The 2030 targets, if people met their pledges there, 2.4. If people met their targets and pledges that were mostly 2015, the reason this is lower at 2.1 is because people make bolder promises for 2050 than 2030, right? Because they got more time. And then optimistic scenarios of 1.8. And so that was just because of the work done between May and November, and probably mostly at Glasgow. And so if we keep pushing and pushing and pushing, the numbers that used to be 4.0 for policies are getting down to 3, to 2.7, to 2. I'm again confident we have everything we need to push forward and make progress here. And so what I think we really need is the exercise of imagination, and this COVID and climate and our reckoning with racial justice forces us not to rest on the laurels of the ways that we have done things, ask us to have the courage to challenge the ways we have done things fundamentally and reimagine, to have that work of imagination, to picture what this world could be like, and determined to move forward with ambition and determination to make that. And when I picture that world in which we're in right relationship with the earth, we're in right relationship with our food systems, our energy systems, our transportation systems, that is a thrilling place to be. That is a place in which the health co-benefits of our climate action blossom out. And those 9 million people a year who are dying from air pollution alone, that number goes away. That the food that people are eating is healthier for them, that they're biking to work instead of going on a commute every day. This is the way we unlock the ways in which we make so many different things better at once by doing that deep-rooted work. And that's why I feel so committed to climate action, because it gets to the heart, the deep-rooted work of how we make progress in this world. We've talked a lot about the impacts of climate change disproportionately on communities of color. I just want to elevate the point also that in these communities, and I want to highlight Indigenous communities, is where much of the wisdom exists. And so, Indigenous communities make up land masses of 25% of all land masses around the world. And it's about, I believe, I always have this number at the tip of my head and I'm forgetting now, but it's about 75 to 80% of all the biodiversity in the world. And so you can really appreciate that Indigenous communities are disproportionately doing the work of holding our ecology together. And there's a lot of wisdom and lessons that we need to be employing in all communities around the US and around the world. Drawdown is this book when I was staying up late at night and really stressing significantly. My wife bought me this book. It's 100 pages of 100 great climate action solutions. And you read this book and you know that we have everything we need to turn course. So I do believe that climate change is fundamentally about our relationship to the earth, each other, and future generations. It's about our interconnectedness and our common humanity. It is deeply rooted in issues of racial justice. And again, I think the challenge for us is not to shy away from that work, to keep looking and not look away. And so what do we do with that? And I'm going to go through these a little bit quickly in hopefully just about 5 minutes here. But in taking action, the things that come to my mind that are important is to declare our values, to tell our stories, to build community and power, and to make structural change through policy. I am very policy oriented. I believe in policy. We're really trying our best to make lifestyle changes. I barely talk about that because we can't live in a fossil fuel infrastructure and expect to get to where we need to do. We need to change the structures, and that's where we need policy. And so community organizing, I'm going to tell you about a fellowship that we're just starting, has been a framework that has been really important for me to understand how to make structural change. And the fundamental questions here, my learning is from Marshall Gans at the Harvard Kennedy School. He asked the fundamental question of community organizing be, who are my people? What is their problem and goal? And how can we turn our resources into power to achieve the change that we want? We have resources and abilities that sometimes we don't even capture and take advantage of because we are made to feel like we are powerless in the face of these big issues. And so his work, Dr. Gans's work in community organizing, creates this framework of the narrative work, the strategy work, and the action work. And I put an arrow by the narrative work because I personally think that this is critical. And in medicine, we don't do enough of that, of the storytelling work, of the values work, of declaring what we believe in and why. This is where we can, we can try to connect with people, even people that we don't agree with on a lot of stuff, and find shared values and talk about the things that we cared about. For me, it's often, talking to parents and talking about children. And so, the work of emotion is important is because when you feel something, an emotion, it can often elucidate a value that lives within you. And you may not even know that was a value. For me, I didn't really truly appreciate how much I valued planetary health. I was focused on human rights work, on racial justice work, on improving healthcare access in the U.S. healthcare system, or getting community health workers in rural villages in Liberia. And I hadn't connected that, hey, decimating the planet is a part of all of that. But once I started seeing it, I now get an emotion, right? When I see if a tree is cut down, I get a reaction to that because it's a value is declaring in me that I maybe didn't even realize from before. And emotion also, when you speak in emotional language, it can galvanize other people to action. And so, data is really important. I really believe in data. I use data a lot, but I think it needs to be married with the storytelling work as well. So storytelling translates values into the motivation for action, and it can build relationships, intentional relationships for purposeful collective action. I like this quote from Dr. Gans, that narrative is how we learn to access the moral resources, the courage to make the choices that shape our identities as individuals, as communities, and as nations. And then public narrative, I'm not going to go through this too much, but this is a storytelling craft in which we tell stories that access emotions, connect to our core values, connect and find our people, break inertia, and inspire action. And so this informs the work that we're trying to do in our fellowship. So we just launched in January, We have 40 fellows from across the country. We ask people to apply in groups of 3 or 4. So we have 12 groups of 40 fellows. And we just started a few weeks ago in January. We have these monthly sessions and weekend immersions. We have personalized coaching. So these groups come to us and we're teaching them about community organizing. We're teaching them about climate and health equity. And they're provided with a personalized coach to develop a community organizing campaign that will improve climate and health equity in their local communities. And why we took this approach is because we think climate change is a public health and health equity crisis, that health professionals are well positioned to be messengers and change makers, but that we're really burnt out and we're operating in a fragmented, chaotic, often dysfunctional healthcare system. And because of the emotions that you all listed, that it's daunting and overwhelming, we need collective action. If the problem is collective and broad and overwhelming, we need to band together for collective action. All right, these are our partners in that fellowship. And I'm going to stop there. And listen, I think, again, I'm a deep believer in community. I have no pretenses of how hard this is and how much work is ahead of us and how deeply rooted these issues are. But again, I think we have the opportunity to come together to reimagine this future that we all deserve. All right, thank you.